Cross Sport Models.
It's time to go red for women. I'm Latrice Curry. Please join me on Friday, February the 5th and wear red. Then be sure and share your photos at the hashtag #GoRedChat.
From our factory to your home, Mermaid Mattress, better price.
Okay, here we are set to flip the calendar to the month of February. Hopefully by now some new habits that you brought into your life for 2021 are becoming just that, healthy habits. But if you are still kind of getting yourself there, we've got some help for you this morning. Dr. Chelsea Ryan is a family medicine practitioner. She is with CHI Memorial Integrative Medicine Associates up on Signal Mountain. Good morning to you.
Good morning. How are you?
I am fine, thank you. I know that we'll focus a bit in our conversation about how to bring those healthy habits into your everyday life and some other topics as well. But I want to focus a second on the benefits of family medicine. It's kind of a throwback, if you will, to the days of old when your family doctor knew everything about your family. That's so important for a patient, don't you find?
Yeah, so I really chose family medicine, or family medicine chose me because I just loved everything from babies to, adolescents, adult medicine, and geriatric medicine. And this was really just a good fit for me. And it's really nice to see those kids grow up, and you get, there's never a boring day here because it's always changing up and you always see different things. So I really enjoyed it since I've chosen it. I think people really enjoy, seeing their doctor throughout their entire lifetime. So that's kind of what I hope to do.
There's I think a very old anecdotal kind of a story, but about a patient going to the doctor and saying, I can't figure out, why I'm not feeling good. And clinically, there really isn't anything, but through conversation, the doctor pulls out some stresses in that person's life and some difficulties, and it becomes partly a psychology appointment too. You kind of play a lot of roles, don't you?
Yeah, we do. And just to touch on that point, there was a famous, theorist, William Oswald, who said, the patient will tell you what's wrong with them. All you have to do is listen. And so kind of just on your point, that is the biggest thing that I try to uphold as a doctor is basically just to listen to the patient, because they're going to tell you what's wrong. It's your job to put those the pieces of the puzzle together and come up with a diagnosis. But as long as you not only listen, but know that let the patient know that they're heard, that's kind of really my goal for a patient and physician encounter. So that's what I try to bring to family medicine, and hopefully we succeed at that.
Okay, so with that in mind, let's talk about how you listen and yet also advise. So for the people out there who are looking to get healthier in 2021, I guess it's never good to wag a finger in someone's face. It can be fun if you look at it from the perspective of what you add to your diet rather than taking away.
Yeah, and so looking just at your diet as a whole. So I always tell my patients to start with one specific small thing. If their vice is soda, we're going to switch to water. If their vice is, potato chips, we're going to switch to nuts or something crunchy that they find delicious. So I don't advise patients to do everything all at once. We'll have lots of small, short visits and kind of just have small miniature goals to kind of, okay, this month we're going to focus on this. You've achieved that. Awesome. Let's move on to the next thing. And so I say, and I get this from, my workout videos, it's progress, not perfection. So I don't want you to change everything all at the same time, because sometimes that sets us up for failure. So just small, big goals, and then we reward ourselves for each one, which is also fun, that you meet.
You are a big believer, I think, in the benefits of fiber. Why should we be adding fiber to our diet?
Yeah, so fiber is found in your whole grains and your whole fruits and vegetables. And when you refine some of those things, like your flours and stuff like that, it actually takes out some of the fiber and the nutrients. And so when you have a good amount of fiber in your diet, it keeps you fuller longer. If you've ever noticed, you're fuller after eating 2 oranges versus a glass of orange juice or something like that, but also regulates bowel habits, which is also very important for your health.
Talk to me a little bit about exercise. I've never been a huge exercise buff. My husband absolutely is. I kind of wax and wane. Is it my imagination, or when I do get into that exercise routine, I feel like I do have a lot more energy?
Yes, that's true. And so the American Heart Association recommends that you get about 150 minutes, 150 minutes of moderate cardiovascular activity per week, or 75 minutes of vigorous activity per week. I never recommend that someone goes from sitting on the couch all day to doing that. Like I just said about mini goals, let's just start with walking 5 to 10 minutes a day or a couple times a week. And it really has to be something you enjoy. So I don't want you to go run a marathon if you absolutely hate running. If you like listening to your favorite podcast, or watching your favorite TV show while you're on the treadmill, or talking on the phone to a friend that lives, a distance amount away that you don't get to see, or in COVID times, they could live right down the street, but you don't really get to chat that much. It's nice to just go out for a brisk walk. Maybe you get a little jog in there, and you can, do something fun that increases endorphins, makes you happy. But if that's not your thing, you can find videos on fitness apps on YouTube that are free, sometimes on Amazon Prime Video, those types of things. So just finding something that, number one, you enjoy, but number two, fits into your lifestyle. If you don't have an hour to work out, I don't want you to work out for an hour. That's too stressful.
Right.
20 minutes of HIIT exercise, that high intensity type of like jumping and things like that. And that's all you can do. That's all I want you to do, because this is about a lifestyle change, not about just, changing something for a few days.
Less than 2 minutes left. We had a conversation a few minutes ago with a master gardener here in town. If you have not been doing a lot of exercise, even developing a hobby that keeps you moving, is that a good idea?
Yeah, so actually the American Heart Association lists several exercises, and one of them is dancing. So that can be a part of your 150 minutes, gardening, or doing any type of like outdoor work. And especially during COVID times, that's something that can be socially distanced, done in your own house. If you're going to plant a garden, or you have a nice project or a shed or something you want to do out in your backyard, that is definitely something to keep you active. It's about not sitting and getting moving. So yeah, and anything like that, I am on board with.
Okay, you are delightful. So in your practice, you're taking new patients?
I am, yeah. So please call anytime up here. We are taking new patients. I have 2 other providers up here, and we are just eager to grow the practice. We really, really enjoy our patients up here, and we're all about integrative practice. So we offer acupuncture, we offer some psychology, we offer nutrition up here. So we are really just kind of not only trying to focus on certain diagnoses, but you as a whole person, and keeping you healthy and setting you up for success.
I will let you end it there. There is the phone number, 886-2004. Thank you, Dr. Ryan.
Thank you for having me.
What's in Zaxby's new General Tso's sauce? Legendary chicken, legendary sauce. The new General Tso's boneless wings, only at Zaxby's. Redeem rewards, scan to pay, and order ahead on the Zaxby's app.
Did you know that 178 million Americans are missing at least one tooth?
It's true.